Good morning, everyone. This is Christina, pharmacist with iPharma Pharmacy. Today we have the pleasure of having Dr. Miiko Rowley as our guest speaker for our podcast. Dr. Miiko Rowley is an esteemed medical professional holding a medical degree with the Wake Forest School of Medicine and a residency at the University of Texas here in Houston. As a highly skilled board-certified family medicine physician and an IFM certified practitioner. As a visionary behind Kell Functional Medicine, located at 230 Westcott Street in Houston, she has fostered a thriving practice. Over the span of over a decade, she has delivered unparalleled patient care, earning her a sterling reputation in the medical community. It is with great enthusiasm that we welcome Dr. Rowley as our distinguished guest speaker. Today, we have the privilege of learning more about her professional journey, exploring her practice, and uncovering the passion that drives her forward. Dr. Rowley, it's an honor to have you here today with us. Please tell us a little bit more about your background and what inspired you to pursue a career in functional medicine.
Yes, first, thank you so much, Christina, for that lovely introduction. I appreciate that. I came into functional medicine, actually I came into medicine as a career changer. I used to be a financial analyst and decided to do a 180 and become a doctor. So I had to go back and take all of the science classes that I didn't take in undergrad, take the MCAT. I'd finally gotten into medical school, and I was about 3 weeks from starting when I got a whopper of a diagnosis of multiple sclerosis, which is a brain disease that usually leaves people wheelchair bound, sometimes blind, sometimes losing cognitive function, sometimes losing the ability to speak clearly, and sometimes losing control of bladder and bowel function. So of course this was a devastating diagnosis just before starting medical school. And it took a few weeks to come out of that fog, but I emerged from that with determination to figure out, why did this happen to me and how can I preserve all of these functions so that I can make all of this career change impactful, so that I didn't just waste my time leaving my pretty comfortable job and going through 2 years basically of trying to pursue a career in medicine. So I decided that I wanted to do something more holistic, focusing on lifestyle to help preserve the function that I had. I used for fuel, I used the fact that I could see, I could walk, I could think clearly today, so I would just keep riding that wave. And in the last year of medical school, I was able to pair with a physician who, through a similar health journey, found functional medicine and branched off from the medical school and allowed me to come spend a month with him. And in the second day, I already knew this is what I want to do with the rest of my life. And in taking a functional approach to my own health, I haven't had any exacerbations, which are expected with multiple sclerosis to happen. You're expected to have kind of a downward spiral over time, but I've had no symptoms of that disease in over 17 years since I was diagnosed.
That is an amazing journey, and thank you so much for sharing that with us. I really applaud you for your courage and your determination. Not a lot of people can pull themselves out in just a few short weeks after receiving such a diagnosis and still have that level of determination and grit to move forward and say, this is not going to define who I am. I'm going to still take the path that I choose for myself and excel in my life and my career choice. So that's amazing, and I'm sure our listener feels the same way. I'm so thankful that you found functional medicine and that it has made such great changes for you and your health, and also the reason why it has led you down the path to where you are now, because now she's here with us. So there's a reason for everything.
Absolutely, thank you.
Thank you so much. So tell us a little bit more, how does functional medicine differ from conventional medicine?
That's a great question, and I think a lot of providers, even in this space, get confused about some of these distinctions. So first, conventional medicine is just the healthcare system as we know it, which really is a misnomer. More than a healthcare system, it's more of a sick care system. We are taught to figure out what is wrong with you and then how to fix that, either with medication or with surgery. We don't get a lot of tools to really learn how to keep you healthy in our conventional pattern or conventional training. However, in integrative, we combine some of the less conventional practices, like some things that are typical from Eastern medicine, maybe herbs, sometimes supplements, sometimes acupuncture or specialty testing, things that aren't from Western medicine as we know it, and that's integrative medicine. Functional medicine is under the umbrella of integrative medicine, but it goes a step further to give us a paradigm to figure out the root cause of what's going on. It's a process of understanding the way that the body works and identifying where it's dysfunctioning, then treating that so that all of the symptoms that are appearing can be treated.
All right. So I would say it's more proactive than reactive.
Exactly.
And determining the underlying cause instead of just treating the symptoms that a patient presents.
Exactly. And you might also hear terms like naturopathic. That's pretty different from what I do. Naturopaths tend to only deal with natural solutions, so herbs and things that are not medicine. So that's I might also use herbs, but I do combine medications as well when needed. So we take the best of both worlds in an integrative or functional approach.
Okay. And then what about alternative medicine? Is that also different?
Alternative is different, yes, because that's something that you do instead of conventional medicine. So that's typically not what I do. I typically follow conventional guidelines. There may be some alternatives that we do, but we treat the patient. We don't treat to what works for the masses. We look at each individual, look at how they got to their state of current health, and understand how their body is dysfunctioning, and then treat in an individualized way.
All right, so you're very much for personalized care and understanding root cause, personalizing the treatment to each individual. Okay, that's wonderful. And so tell me, what is your process then for customizing a comprehensive care plan, treatment plan for your patient?
Yes, it starts with spending usually an hour with a patient for the first visit, carefully listening and understanding the patient's story and history journey up to that point. A lot of times the patient just needs to be heard. That's part of the therapeutic process. But a lot of times there's intuition that goes into the healing process. And from the patient's perspective, they know, they have so much insight into what has gone wrong.
Yes.
So just by listening, we can get so many clues as to how to help. So that's an integral part to start, just listening to the patient. After that, we tend to do specialty testing, which goes a step further than what our conventional counterparts typically do, which gives us additional insight as to how we can help. So that really helps functional medicine shine in areas like with chronic fatigue, long COVID, autoimmune disorders, gut health issues, a lot of places where our conventional algorithms or paradigms stop. You kind of get to a point where all of your labs are normal, and so we don't know what else to do. But in functional medicine, we can keep going because we've got other tools. So we do specialty testing. And then our treatments a lot of times will consist of supplements, sometimes acupuncture. We pair our patients, all new patients get a visit with a health coach to help implement lifestyle change It's all contingent upon lifestyle change.
Yes.
If you keep approaching the same set of symptoms with the same lifestyle, you can't move forward. So lifestyle change is integral to moving forward with functional medicine. So that is a big part of it. We use IV therapy, and then we also use medications when needed. We use it very judiciously, but there are certain times, especially if there's infection, we definitely use medications, but there also are other appropriate situations. And again, it's individualized, so it depends on the person and their set of symptoms.
So what I'm hearing, I really like a lot of key things that you said that I gotta say from my personal experience in the doctor's office, 15 minutes tops. And nothing against my doctor. I love my doctor, okay? Love you, doctor. But 15 minutes because they're so busy and I'm out the door. And fortunately, I'm very healthy, so I'm not needing more than that 15 minutes. But for a person who is dealing with, like you said, with chronic pain or an issue that they intuitively know goes far deeper than just the superficial symptoms, you need that one-on-one and that deep probing and the listening. Like you said, the listening is so key that I feel a lot of time with conventional medicine, you don't give that opportunity to have that one-on-one.
Yeah.
So I really think it's wonderful that you dedicate that time to your patient.
Thank you. And I want to be clear that I'm not knocking my conventional colleagues, because I'm that person too. When you're in the insurance-based system, there's a lot of pressure on you to only spend 15 minutes because you've got to meet your numbers. You have to see so many patients to make that model make sense and for it to work. There's insurance. There's pressure from the insurance company, and the physicians would love to spend more time with their patients than 15 minutes, but they just don't have the luxury of doing that in that sort of model. So their hands are pretty tied, and I've been in that situation, and it's not fun. So
where you're not able to truly practice medicine how you want to practice it.
Exactly.
Yes.
Now I am.
Yes, I can tell just from your smile and from what you're saying that you enjoy what you do and you're passionate about it.
Absolutely.
Tell me more about specialty testing. So give me an example of a specialty test and how it differs from, say, conventional testing.
Yes, one of my favorite tests is a gut test, which is a stool test that tells us the makeup of the microbiome, which is all of the viruses, bacteria, fungi that should be in the gut. And sometimes there are bad bugs that should not be there, including parasites. So we want to understand that makeup. We want to understand if there's any imbalance of that bacteria. So we want to get that in the optimal balance to create health and longevity. We want to see if there's inflammation. We can find that out because the more inflammation there is, which when it's created in the gut, it gets right into the bloodstream, because that's where you're absorbing all of your nutrients. So you're also absorbing all of that inflammation at the same place. So that's an important place to stop inflammation so that it doesn't get spread all over the body. So we can see inflammation, we can see how well the gut is absorbing, we can see whether there is a deficiency in digestive enzymes, making it more difficult to break down food. We can see if there's sensitivity to wheat. So just a lot of great information, and then we can treat that and get over these symptoms that our conventional testing doesn't pick up. We do a colonoscopy, it's normal. We do an endoscopy, a tube down the throat, and it's normal. And then, the patients are left to figure out why they are gassy or bloated. Another good one is food sensitivity testing, which is a blood test that shows whether or not you have an immune response to certain foods. So it's not allergy testing, because there's a different immune protein that responds to allergies, which typically happens within 24 hours. But for sensitivities, it can take 48 to 72 hours for one type of protein, or up to 2 weeks for another type of protein. So it gets really hard to tease out what those sensitivities are. But the symptoms of those sensitivities can build up over time, causing increased anxiety, increased skin problems, brain fog, joint pain. Like once that inflammation gets into your bloodstream, it goes anywhere it wants to go in your body. So that's also a really good one. And another one that we use a lot, probably our third most popular, is a micronutrients test, where we look at all of your vitamins, all of your minerals, all of your antioxidants, and we can optimize those to help get your energy back, especially after big viruses like COVID or the flu, RSV. And also to make sure that you're not just taking buckets of supplements. Just take what you need.
Yes, yes.
So those are a few of my favorites, but there are really literally hundreds of tests. You can test for Lyme and mold and environmental toxins, and really just, whatever the patient's story leads us to, we can do further specialty investigation to find things.
So you're like a true detective.
Exactly, I love
uncovering.
that.
Yes, I love it too, because like you said, our bodies tell a whole array of stories, little doors that opens up to different areas that we need to uncover, and you're the ones opening the doors and letting us know what's behind each one. So that's amazing. Tell me then a little bit more about the nutraceutical therapy. You mentioned it briefly that you may use supplements to treat patients. So after the testing is done, what kind of supplements do you start your patients on?
Yeah, I love our nutraceuticals, and I love that word because it really, these are not your GNC vitamins. These are pharmacy grade supplements that really are not accessible just by walking into a vitamin shop and ordering them, because they've got, they're very highly potent, they're very specific, they've been researched. These are just as effective in many cases as pharmaceuticals, sometimes not as quickly, they don't act as quickly, but they can be just as impactful. For example, one thing that a lot of our patients take is a nutraceutical for high cholesterol. And studies support that red yeast rice and bergamot are as effective as certain statins. So there are plenty of studies in the literature that support that. So yeah, nutraceuticals really have a strong impact without the large side effect profile that some of the medications have. Yeah.
I love that you brought up statins, because one of the challenges is the rhabdomyosin, the muscle atrophy that some patients may experience, and the minute that an older patient tells you, oh, I have a bit of aches and pains, doctor's like, no statins. Okay, then what do I do to treat my cholesterol? Well, I guess now you go to second line therapy, third line therapy, and then like you said, there's that algorithm in conventional medicine that at some point is just not right for that patient. And if more patients were aware that there is that nutraceutical therapy in place of statins, I'm telling you, people would be lining up at your door. And I'm sure they already are. But just letting me, just hearing that, I am already excited. And I would be sending patients already to you.
Thank you. I also want to caution that we don't want to replace nutraceuticals for pharmaceuticals. Really the key for getting something like cholesterol down is lifestyle change. You've got to change your diet. You've got to start moving. Those are the keys, and I impress that upon my patients, that if you just change your statin for bergamot or red yeast rice, you're not going to make any improvement. You've got to also start walking 4 times a week. You've got to also cut out the sugar in your diet, because it's the sugar that's building up that's causing the cholesterol. It's little things like that that we can change, that don't have to be an overwhelming change, but that will push us forward in getting that treatment to replace a statin. So it's not just replacing the medication for a supplement. There's kind of a lifestyle shift that goes along with it.
Well, the amazing thing is that you have a lifestyle coach that can guide the patient, because that's a lot of things that I think as health professionals we struggle with. I know one thing that I always told patients, walk, and they're like, I've been told so many times to walk, but then we don't really delve further with them. We don't sit down to review their diet, what they're eating. We don't really advise them on other ways that they can remain fit, what kind of stretches that they can actually do that what's, really help them, because I'm not trained in that. I would not know the first thing to recommend. That's why I keep saying just walk. So the fact that you have someone on board who can go that extra mile and help patients really make a change in their lifestyle, I gotta say, she has a very well-rounded team, and so amazing that you have this put together. And that's why I say well-oiled machine here. Everything looks so easy and so stress-free, but nothing works this well without tremendous effort.
Thank you
and
so
commitment.
much. I'd like to say about the health coaches, lifestyle change can be overwhelming, and if it was easy, everybody would do it. So I think that it really helps to have that guide. Not only do they look at how you're moving and how you're eating, but they individualize that to you. If you're a mom, how do you make this work and also get dinner on the table for your kids?
Yes.
And something that your husband might want to eat. If you are a man and single, how do you prepare something at home and still, or if you don't cook, how do you prepare something that's healthy? So, they really meet you where you are and come up with a plan that's individualized to you. So they still keep that individualized approach and take the overwhelm out of the lifestyle change. That's really the difference maker, because, you can tell a patient, go make your lifestyle change, but then you get back into your normal environment and you're doing the same things, you have the same pressures, the same stressors, and nothing's going to change.
Exactly.
And they really have a great training guide into tapping into your why. Why is this important to you? They're coaches.
Yes.
So they know how to tap into that motivation and then be an accountability partner. So you're not just left flapping in the wind. We also have a nurse practitioner, Miss Melissa Bassett, who has over 15 years experience in functional medicine and is a great resource. She sees children and adults. She sees more of the children than I do. That was her specialty in nurse practitioner school while she was doing her master's. I see children as well. She just sees more of the children. And her patients love her. She's very empathetic. She's a great provider. And we work very closely together. So she's also a great resource and is taking new patients as well.
Thank you. That, I think, is what it takes. It's a comprehensive approach. It's recognizing, like you said, the specialty testing, the nutraceutical therapy, understanding that bringing in conventional medicine as well where needed, and then making the big lifestyle change to really achieve the outcome that we need. So let's talk a little bit about the conventional side, because you said you still support conventional medicine. You're still a conventional doctor. How do you feel you practice conventional medicine in a functional way?
One good example is, again, going back to cholesterol. When I do cholesterol testing, I look at advanced markers of inflammation and the particle sizes of the cholesterol, and markers of higher risk for that cholesterol. And depending on how high the risk is, I might recommend a statin for a patient until we can get some of those things down. But of course, at the same time, I'm recommending I typically recommend CoQ10 at the same time because that gets depleted. I'm recommending that you have to walk. You've got to or do something for exercise. Sometimes it's in the pool. If they've got joint issues, we're talking about what you're eating. We're talking about possibly wearing a continuous glucose monitor to get insight into what things are driving up your sugar that might be driving up your cholesterol.
Yes.
So we're looking at all of these things still when we do prescribe. So we're doing specialty testing. We're kind of still pulling all the pieces together when we're prescribing. Another place where I will typically prescribe is for infections. If there's like a urinary tract infection, without a question, an antibiotic should be used. Urinary tract infections can be dangerous and lead to sepsis if not treated with antibiotics right away. So I don't recommend herbal treatments for UTIs ever. Sometimes we find in those stool tests bad bacteria or parasites. And a lot of my patients, most of my patients, want to get that thing out of me. So a lot of times we'll use a dual approach with medication and supplements. And then just depending on the patient, sometimes they want just something that's going to work faster. So pharmaceuticals do tend to work faster. And then we can do something that way sometimes for sleep. We've got some more natural things than the typical sleep medications that we can use. There's so many avenues, especially when we're working with a compounding pharmacy like iPharma, that will allow us to prescribe, and sometimes not even in a conventional way. But there's just so much beauty and flexibility in how we can individualize our approach and our care for our patients through pharmaceuticals.
Yes, and I gotta say that the prescriptions that we receive from you, I always see very personalized. Very geared towards that patient, because I call the patient and they always say, yes, she is doing this specifically for me after she's done this test for me. And so then I know that, Dr. Rowley is truly, her path to caring for a patient is very personalized, very individualized to that patient's story. And when it comes down to us, as a support for her patient and her clinic, we try to take that same approach so that we provide that same level of personalization and flexibility so that she can care for her patients to that same level of personalization. So
the IV infusion services that we have are actually pretty extensive. In addition to the vitamin therapy, we've got some pretty exciting therapies with high dose vitamin C, which helps with skin glowing, and it's great as an antioxidant. We've got B12 shots, which help with energy and weight loss. We've got metabolic boosts, which also help with weight loss, energy boosts, which help obviously with energy. We've got an immune boost, which is wonderful during allergy season. Really just helps bounce back from allergies very quickly, as well as bouncing back after a big virus. So, not during the virus, but after the virus, when, you're still kind of laggy, it's great to get those vitamins in and good hydration to build back up. NAD is a great one also, and we love doing NAD by infusion therapy, and then in between doing a nasal spray from iPharma, and then the patient can really feel boosted without having kind of the up and down cycling of their energy. And one that we do that you won't find in most kind of corner IV infusion therapy spas is phosphatidylcholine, which is a medication that helps the brain. A lot of our mold protocols will use that. Some of our patients with multiple sclerosis are using that to help with cognitive function. Phosphatidylcholine is part of the fatty layer that covers our nerve cells, that helps conduction between nerve cells go faster. So that's the science behind it. And a lot of patients with neurological disorders can benefit from it. Some of our Parkinson's and Alzheimer's patients also are getting phosphatidylcholine infusions. So we're really excited about that one too.
So tell me about your infusion therapy. When a patient comes in, typically how long are they in clinic and to receive their infusion?
Usually it's 35 to 40 minutes. Some of our therapies are shorter, some are longer. For example, glutathione can be given just by a push, so that would be maybe 10 minutes. Whereas something like high dose NAD needs to be infused over a couple of hours. So there is a range, but typically it's going to be about 30 to 45 minutes for most of our IVs.
And do they do this once, or is it multiple times a week?
It's all individualized. I'd say the most common frequency is once every 2 weeks.
Okay.
Next behind that would be about once a month. And then sometimes once a patient starts to get better, then we space it out and make it less frequent.
Okay. Thank you so much for that. Definitely learned a lot about IV infusion.
When patients show up at our IV suite, they're greeted with nice, comfortable, reclining chairs and a warm blanket. It's very soothing in that room. A lot of our staff at lunchtime like to just go there and hang out because it's so zen and calming and relaxing. So it's really a great space, and in a different suite than our medical clinic. So it feels more like a getaway than being in a medical environment.
So is there a retreat?
It's a retreat. Actually, that's the name of the room, retreat.
Well, what do you know?
I've worked with several compounding pharmacies around the Houston area, and I'd say that iPharma is second to none in your white glove service with keeping patients up to date, informed, keeping us in the loop. Just communication is top notch. Just the experience has always been above and beyond, so I'm very appreciative of just that excellent service that we've always consistently received from iPharma. Thank you.
Well, thank you, Dr. Rowley, for giving us that opportunity to service you and your patients, and your trust really means a lot to us. But going back to your practice, I really want to know, what is a core focus that you really practice in your clinic?
Sure. Gut health is one of our core practices. Thyroid is also a big, especially hypothyroidism is also a big percentage of our population. Bioidentical hormone replacement is also huge. Those are probably the top three of all of our treatments. We do a lot with chronic fatigue, long COVID, autoimmune disorders. Those are the biggest issues. Really, with functional medicine, there aren't specific diagnoses that we treat. We're really looking holistically at the patient. So instead of focusing on diagnoses, we're treating what's dysfunctional in the patient, and the symptoms go away. So then, the diagnoses, whatever they are, get better because the symptoms get better.
Very true. So that's a lot of areas, like you said, you don't really focus on the diagnosis, but that's a lot of area of specialties that you treat in your clinic. But just to pull one so that we can focus on one and just learn a little bit more about that. Bioidentical hormone replacement therapy is a very hot topic right now that I'm sure our listeners would very much love to learn more about. Tell me, how is bioidentical hormone replacement therapy different from conventional hormone replacement therapy?
Yes. The bioidentical hormones are made from a yam source, and a lot of patients will ask me, well, can I just eat yams? It's not concentrated enough. So you can eat yams, and you should eat yams, but that's not going to necessarily fix your hormones. But the conventional hormones on the estrogen side were made from pregnant horses, pregnant marins specifically, and that's where the name Premarin came from. And so those big, strong, pregnant mammals, estrogen is way too strong for our little mammalian bodies, so it just tends to be overpowering, and the structure is much different from the structure of the yam-derived estrogen. And so when it comes into our body doesn't recognize it, and so there can be a lot more side effects from it. And the progesterone is a synthetic progesterone in the conventional side, which is called progestin. And again, our body doesn't recognize it, so there are a lot more side effects. The most notorious one is weight gain. So a lot of times women are put on birth control pills and gain a lot of weight, or start hormone therapy during perimenopause and also will gain weight because of the conventional types of hormones.
All right, so then the bioidentical BHRT, let's say for short, is supposed to minimize the side effects because they resemble our own hormones and are recognized by our body more easily.
Exactly.
Are they more effective then as a result as well?
There's a lot of debate about whether or not one is more effective than the other, but it's very clear that the side effect profile is definitely better for bioidentical hormones versus conventional hormones.
Okay, and that's why you would definitely go with the BHRT versus conventional hormones.
Absolutely, yes. The biggest thing is, a lot of women are coming to me during perimenopause because of increased weight gain. And so if I put them on conventional hormones, then they might see even more. We might work against ourselves with that increased weight gain. So I definitely would go towards the bioidentical for perimenopause.
All right. Thank you for that explanation. Tell me, there is a lot of misconceptions that patients may have about bioidentical replacement, hormone replacement therapy. What are the biggest ones that you've heard that you would like to clear up for your patients and our listeners today?
A lot of patients are afraid that it's going to increase their cancer risk, and
Yes.
that misconception has come out of the Women's Health Initiative, which was a study done decades ago with women over 65 who were started on hormone therapy more than 10 years after menopause started. So in this population of women, they were already more likely to have cancer in their population. So, we're at a starting point where it's more likely to be found. So that's not a great study when the population already is more likely to have the disease that you're looking for. Then, on top of that, they were using different hormones than what we're using in bioidentical hormone replacement therapy. The pregnant Marin estrogens that I talked about, Premarin, was the estrogen that was used, and progestins, the synthetic progesterone, was also used. So, of course, the results were different. And they were in a population of women that were more than 10 years away from starting starting menopause. So in our guidelines for hormone replacement therapy, we are typically starting within 10 years of the start of menopause, and in a younger population with different hormones, and the studies don't support any higher incidence of cancer with bioidentical hormones.
So how do you assess your patient's cancer risk prior to initiating therapy?
Well, yes, we do specialty testing typically through a urine test that shows how a patient metabolizes estrogen. That's the biggest concern, that estrogen, because estrogen is metabolized in different ways, and there's one that acts as a free radical, one breakdown product of estrogen that acts as a free radical that can attach to DNA and make it more likely that you will develop cancer. So before we do any hormone replacement therapy, we look at how a person or how a woman typically, this is more relevant to women because men would get testosterone, which is doesn't have the associated risk, but we look at how women are breaking down the estrogen, and then if they're at higher risk, we can do one of two things. Again, it's always individualized. If they have a higher risk and we can mitigate that with supplements, then we'll do that. If they have a very high risk and also have a family history of a mother or sister with breast cancer, then we probably wouldn't go that route. So on a case-by-case basis, we make decisions using all of the information that might play into their risk factors.
Okay, so that's really addressing some of the key misconceptions about bioidentical hormone replacement therapy. We have already addressed if it's safe, definitely a safer side effect profile, and then effectiveness, debate on that, but going for what is safer for patients in terms of, easier recognized by the body, less side effects overall. Okay, so thank you for that. Now, regarding the BHRT, you do send BHRT compounds to our pharmacy. you've mentioned you've used several other compounding pharmacies in the Houston area. Why choose iPharma as your go-to pharmacy for your patients?
Well, first, I love that the quality is top-notch. I don't have to worry about whether or not we're meeting standards. iPharma goes above and beyond the quality standards, so I trust the pharmacy. It's also basically in our backyard. It's nice to have a neighborhood connection. You're almost across the street. So that certainly helps. It's convenient for me to tell patients, you know, go down, make a right and go down the block, and iPharma is located right there. So that certainly helps. Also, like I said before, the excellent service has always been top-notch. In the years that I've been associating with you, we've never had any complaints on either our side or any patient side. It's just always been a lovely experience. And coming in here, it's beautiful. I feel like it fits the kind of way that we approach our service, where we want to create an environment where you feel better just walking in the front door. We want you to just have that feeling when you walk in, and moment. I definitely feel that when I walk in the front door here. So I love that we just have a similar approach to care. So just for so many reasons, I think that it just makes great sense to be close partners.
Thank you for your trust in us. Thank you for those kind words. Would love to say that, you know, of all the clinics we work with, Dr. Rowley's clinic, her staff, their commitment to their patient, top-notch. We've worked with many clinics as well. They do stellar jobs and, you know, great care for their patients too. But her staff, they really go above and beyond. Dr. Rowley goes above and beyond, and it shows. It shows in how her patients, how knowledgeable they are. When a patient tells you something medical-wise and it's sensible, you know that they have received proper education from their physician, and that alone is very, very valuable. So she is amazing. She is an amazing physician. Her staff is an amazing crew, and I'm so happy to have her here with us. And I really do wish that our partnership is a very prosperous and a very long-lasting partnership.
Likewise. Thank you so much.
Thank you. Dr. Rowley, I do want to touch a little bit on your passion. Tell me, what do you enjoy most about your work?
I love when a patient really gets in there and makes the changes and comes back and they feel great and they say, thank you so much, this worked, and they just have that transition where they just get it all works together, and I see them feel better, and then they go out and they spread that to their community. They feel better, they help their children feel better, they help their community feel better, they spread that love. So that's a great feeling.
Yes, when you know it's impactful and there's a ripple effect.
Yeah.
Yes.
That's why I changed careers, because in finance I felt like I was making no difference. I said I want to do something where at the end of the day I feel like I've made a difference. So when I get that feedback from people that I've made a difference, that's what really drives me. That's what gets me into the office every day and keeps me there late sometimes.
Yes.
And well, not all the time. I try to have balance.
Yes, work-life balance.
Too, but,
yes.
That's what drives me.
Okay. I share that same commitment with you, as being able to make that difference, being able to see that light bulb moment in your patient when they realize that everything comes together, everything makes sense now, and when they actually move forward to make that change, it is very rewarding. And it's what really motivates us as health professionals, why we do what we do. So I think you already kind of touched on it, but what do you really want your patients to take away from a session with you?
I want them to feel like they can do this, that it matters how they eat and how they interact with the people in their household, and how they take care of themselves in terms of their mindfulness throughout the day, how impactful their lifestyle can be, and how much control that they have over their own health. That's the biggest thing, that I don't want them to feel powerless, like their health is not in their hands. I want them to understand what they can do to create health. I think so many people just feel hopeless by the time they get to us. They've been to so
Yes.
many doctors, and everyone has said nothing is wrong with you, go home. And then they show up at our doors like, this is my last ditch effort, help me. I love it when they feel like they finally have hope again.
Wow, you said something very poignant right now. You said that they can create health. I think a lot of us feel, in regards to our health, we are dealt certain cards, that it's out of our hands. You know, oh, I'm sorry, you have cancer. Well, you didn't ask for it, but now you have to deal with it. But you can create health with how you respond and how you make the lifestyle changes and you know, approach health in a certain way. That is a very powerful message. Keep spreading that message. I might even steal that saying from you. Give you proper credit though. I will say, quote, Dr. Miiko Rowley, but that is very poignant. So,
you know, we do have our genes, but it's not so much the genes that you have, it's the environment that you place those genes in. And
yes.
I'm a prime example of that. I have genes that predispose me to multiple sclerosis, and if I put those genes in an environment that would help multiple sclerosis thrive, then, you know, I might be wheelchair bound. I might have optic neuritis that leaves me blind. I might have slurred speech. I might not be able to think clearly, but I don't do that. I live clean, and it's not perfect, you know, but it's at least 80%, sometimes a little better. But, you know, it's at least 80% clean, doing what I should do. And that just helps you get over the hump. And if you put those genes in the right environment, then you don't have to necessarily have those symptoms that in the conventional paradigm we call, we assign to a certain disease. So in that way, I believe that we create health. We go to bed on time. We, you know, spend time with people that are meaningful to us, and we do things that bring us joy and passion and fulfillment. We exercise. And we don't have to be Iron Men, but, you know, get out there and move a few days a week. Eat well. You know, we just kind of create this ecosystem around us where we're putting our genes into a good environment and we're thriving instead of kind of in this slow downward spiral that our typical Western paradigm has led us into.
Very much the nurture versus nature
Absolutely.
kind of argument here. So very true, very true. Nature is one thing, but how you nurture the nature is going to yield completely different results.
I love that.
Yes. So thank you so much. I'm sure our listeners and our viewers would love to know more about your service. Tell us, how can they learn more about your services?
Absolutely. You can go to our website, kalemd.com, KALEMD.com. We're also on Facebook, Instagram, and LinkedIn, also as Kale Functional Medicine. All three are Kale Functional Medicine.
Okay, and if someone wants to book an appointment with you, how would they go about doing that?
On our website, there is a booking link that says schedule an appointment right on the homepage.
Okay. And then just so they can have an idea of what an initial appointment would be like, what can they expect from an initial appointment with you?
Sure. They will typically get some intake forms to tell us their medical history, and we go pretty deep with that medical history so we can get a running start in the visit and really have an impactful hour together. During that first visit, they come in, we'll spend that hour. We will do a physical exam. I'll really take a deep dive into what their issues are, and we'll tease out how to approach those issues. We'll determine what additional information we might need. We might send our patient, while we're waiting for results from those initial tests, I might send my patient with some homework. Maybe it's cut out sugar until we meet again. Maybe it's start walking for 30 minutes 3 times a week before we meet again. Maybe it's meet with the health coach and tackle a 3-week elimination diet that I provide details on. So sometimes there are some homework where we get started right away. And then again, there's that health coach visit for first-time patients. And they're just going to be really connected to us in that first visit. We'll listen. Everybody from the front desk until checkout is attuned to listening empathetically, which we all know is part of the healing process. So everybody is trained to be a careful listener, an empathetic listener. And then they can also expect to be able to connect to us by calling, being able to get someone on the phone to ask questions, to be able to tap into our patient portal to communicate that way if that's more convenient. So we also take technology to allow us to communicate more effectively with patients as well. So communication, empathy, and listening is what they can expect from us.
Key ingredients to a great relationship with your physician and your care team. So thank you so much, Dr. Rowley. I really enjoyed our conversation today. So much to learn about. You really gave a very insightful and informative understanding of not just your practice, but about, bioidentical hormone replacement therapy, about functional medicine. I really enjoyed having you here. I'm sure our listener did as well. Thank you so much.
It was great fun. Thank you so much.
Please come back another time if
Absolutely.
you have time. Guys, we will list on the link in the next frame here where you can, all the links for Dr. Rowley's social media, where you can go book an appointment with her, where her clinic is, all the contact information for her, and then as well links to where our podcast will be posted. If you have any questions for Dr. Rowley and her team, feel free to let us know and we will relay that back to her. Tag us in any of our social media link and we'll be able to relay those questions back to Dr. Rowley and get those questions answered for you. Please keep in touch and we'll see you next time. Dr. Rowley, I would love to take you on a tour of our pharmacy.
Oh, I'd love that.
Let's go. We do everything under our double HEPA filtered hood. So we're able to do both hazardous and non-hazardous compounding, meaning that both the ingredients, there's no cross-contamination, and it's also safe for the compounder itself. So we really pride ourselves on creating the proper environment to ensure quality of the product and safety of our staff.
Excellent. I tasted one of your sample troches yesterday.
Yes.
And as soon as I put it in my mouth, I was like, this is good. And Miss Bassett was saying, I've never heard anyone say that after putting a troche in their mouth. I was like, I haven't tasted one this good before. So got a good formulation.
Wonderful. I always want to hear that it actually is not only effective, but that it's
Tasty.
palatable. Yes.
Yeah.